Being a first-time mum can be challenging, especially when you're in the workplace. Today, I meet with the women of Blossom Family Chiropractic who provide healthcare and well-being to their patients while raising their little bubs. Let's come take a look.
Hi, I'm Diana. I'm 28 and I'm the owner of Blossom Family Chiropractic.
Diana studied chiropractic at RMIT University in 2009 and graduated in 2013.
I always knew I wanted to start my own business. I always had the intention of doing so. What inspired me to start Blossom was having a space that we can have people come to where they can have their health change from where it was in the past, where it is present, and where it can go into the future. When I was thinking about Blossom, I always had in my mind to create a facilitated space where mothers were able to come and work, come and spend a couple of hours, bring their children into the clinic if needed, to try and create a space where they'll be able to have jobs, be able to support their families.
Okay, purple. Draw.
Jacinta has been a chiropractor at Blossom for almost a year now.
I'm 27 years old and I have a daughter who's 17 months old. I studied to be a chiropractor for 5 years at RMIT University in Bandura. I started back at work when my daughter Annabelle was 6 months old. It was a little bit challenging at the start to leave her and come into work. One of the best things about working at Blossom would 100% have to be working with Diana. She's a mum as well, so she understands it just makes being at work less stressful for us.
While it is rewarding to be a mother and run a business, it can also be very challenging.
I kind of think about it in a way as my two babies, and they both need a lot of attention. When I started Blossom, I didn't really have that in mind that I was going to be doing these two simultaneously. We pretty much opened Blossom's door, and then a month later I gave birth. Some of the challenges would be time management, being present in the moment with my daughter and trying to make sure I spend that time with her as necessary, and then vice versa, being able to take time away from her and I can spend 1 or 2 hours in the practice focusing solidly on making sure that I can help the practice members' health flourish as well.
It's always been in Diana's nature to help and nurture. She finds it truly rewarding to see her patients heal and transform their lives.
We had a lady come in and she wanted to really hold her grandchild without having any pain down her leg. And it was about a couple of weeks ago where she was able to do that, and she was so ecstatic. And those are the moments that make me love what I do, make me love coming to Blossom and want to just continue doing this for the rest of my life.